Hello, I'm Alfie Carlisle. Welcome to The Pulse from Heart, which brings together eminent doctors, psychologists, scientists, and academics to discuss the rapidly changing landscape that is the coronavirus response. I'm joined today by Professor Ellen Townsend, who is a professor of psychology at the University of Nottingham, specialising in self-harm and suicide prevention with a focus on young people. I'm also joined by Dr. Gary Sidley, who's a retired NHS clinical psychologist with a PhD in psychological predictors for suicidal behaviour. And finally, I'm joined by Dr. Damian Wilde, who is a clinical psychologist and a specialist in trauma psychotherapy. Thank you all so much for being here. Dr. Damian Wilde, drawing on your experiences working on the front line of NHS mental health, who is the most impacted by these restrictions?
First of all, I see blockages for people trying to access the vital care that they need. So, for example, there are certain mental health services which are not currently providing face-to-face psychotherapy sessions. And for people who are coming into mental health services, often, for example, people who've experienced trauma, that they're experiencing extreme distress. So actually, this really is a vital part of our care. So some people are not able to access that at the moment. And because of that, their mental health is suffering. I think other things that I see which are problematic are that some of the services which are able to provide face-to-face psychotherapy is that clinicians are being asked to wear masks, aprons, gloves, take temperatures, ask clients to wash hands when they first come into the building. And I think it changes the dynamic between a clinician and a client. And also, I think some of these things, like a mask, an apron, in some senses, they spell danger for people. And for people who've experienced trauma, who need to settle and feel comfortable in the therapy space, this is seen to be impacting upon the quality of the therapy that can be offered for people. And of course, if people are experiencing extreme emotional and psychological distress, really good quality care is absolutely vital. The other thing I'm observing with the clients I'm working with is because of the restrictive measures in place, they're not able to access the vital self-care aspects which keep them well. So I'll give you some examples. Sometimes clients will say to me, I went to a coffee house gathering in group once a week. I went to lunch with a friend once a week. I went to yoga. I went to the gym twice a week. And all these things were absolutely vital for a person's physical and mental health and well-being. Suddenly, all these things which helped keep them well are being stripped away. And for some clients have slipped into a crisis, and it's causing really significant social and psychological harm. There are people in houses up and down the country who are isolated and frightened and scared and are in extreme distress, and I think they are being forgotten. And in my experience, and from the feedback I get from clients, the processing of trauma feels much safer when it is face-to-face, okay? So if a client is feeling extremely vulnerable, they're feeling extremely distressed, it's easier for me to help contain and ease that distress when in person, because there is a clearer connection.
Have you seen an increase in presentation since the start of the pandemic with trauma-related issues?
Yes, so I'd say there's been an increase in health anxiety, an increase in obsessions and compulsions, an increase in generalized anxiety, and an increase in depressive feelings because of, I think, the isolation that's occurring. I think, interestingly, with aspects such as health anxiety and obsessions and compulsions, that this has increased because of the communications that are constantly seen. Like, people have to frequently wash their hands all day. People frequently have to be tested And I think this puts people in fear mode. People's threat systems are being activated more. So when someone's threat system is activated, things around them feel more scary and more fearful than they actually are. For people who've experienced trauma, what's happening is exacerbating the difficulties that they're feeling, because there is this fear rhetoric which is being pushed out there. And I think because of that, this is leading to increased distress, increased isolation. I do know people that, because of the message that all they ever hear is stay at home, stay at home, stay at home, you need to protect your loved ones, is that some people are so scared that they've not left the house at all, not come into services, not even gone out for a walk. But some people are so scared of becoming ill or causing someone else to become ill, so they feel feelings of guilt, because they don't leave the house. And the isolation has led to distress. And I know in some cases, and these are not service examples because I won't talk about them because they're confidential, but personal examples I know is that people have attempted suicide due to the isolation and distress they've been feeling because they cannot leave the house. And these people matter.
Dr. Gary Sidley, if we don't get this right now, what are the effects going to be going into the future?
Very difficult to predict because we're in unknown territory. But one thing is for sure, that the restrictions lead to inflation of fear and isolation. And we know that both of those factors will impact on us all. So I think the impact is on everybody. There are some people out there who, yes, they can use telephone support and they can use computer therapy, CBT, and there are some people who find that quite useful. But I think for a lot of people who seek help, and particularly those with moderate to severe difficulties, it is very clear from the literature and it's very clear from my personal experience that what is key for recovery with those clients is the therapeutic relationship with the psychologist that they're seeing. But all the research points to the fact that if the client doesn't feel comfortable with the therapist, doesn't feel the therapist understands them, doesn't feel that the therapist has compassion and empathy, if you don't get that, you might as well stop, because nothing else, that's the key ingredient. And with isolation and fear inflation and masks, how can you build a therapeutic relationship with a therapist who's got a mask on, given that non-verbal communication is by far the major channel of conveying ideas? The impact, I think, is huge, particularly people who've been already traumatized, but also people who, I used to work with a lot of people who had unusual experiences. So they were voice hearers or very suspicious beliefs and maybe paranoia at times. And we're constantly trying to judge you to make sure that it was a safe place to be. And when you think of the restrictions, pushing the idea of inflating fear and contamination and inflating responsibility for keeping other people safe, that is anathema for people with obsessive compulsive problems. Because if you look at their presentation, if you look at people usually excessive hand washers or excessive checking, what underpins a lot of that is the responsibility for keeping other people safe. They have this inflated responsibility that I might make a mistake and somebody else might get harmed. That's the essence of a lot of their difficulties. And therefore, in this climate, which is deliberately pushing the contamination fears and inflating them, in my view, and also pushing the altruistic, you're doing this for others, you're keeping other people safe. I couldn't think of a worse combination of factors that would exacerbate their distress.
How do we need to change our narrative to allay that?
I think the government should change its narrative and keep the threat in perspective. Yes, it is a nasty virus for some people, but I think the fear about it has been inflated. Well, we know it has, because Sage Minutes of the 22nd of March actually stated their deliberate intention to inflate fear, but really do stop using covert psychological strategies like fear inflation and shaming, which is what being responsible for other people's welfare is. Stop doing that, stop utilizing that as a means of promoting compliance with the restrictions.
I do know clients in some services who, due to health grounds, which may be private to them, that they're not able to wear a mask and have been denied that care because of that. The level of distress involved in that is incredibly significant. Also, stories of NHS staff as well who are mask exempt being forced to wear a mask to deliver the care. So there's a lot of pressure, and I think as a clinical psychologist, I like to try and understand the dynamics, and I think there's some ugly power dynamics occurring and control. I think there's a lot of shaming occurring, not just from the communication style, but we start to see this infighting and conflict and blaming occurring between people. They've pushed out the message to such an extent that people's threat systems, which I mentioned before, are becoming activated, and they feel under threat. So they see a person without a mask, for example, and they think, I need to attack here. And Dr. Sidley's absolutely right. It isn't just people within NHS services and other mental health services who are struggling. It's the general public as well. I've seen people that I know personally who were previously very relaxed people who have now become highly anxious. People are suffering because they're not getting access to relationships and interaction and even touch. You know, there's this, don't hug anyone, don't even hug your family. Human touch is absolutely vital for emotional well-being and connection. And I think we're losing those connections. In terms of what could improve, because I think it's important that we state what we think would improve things. Could there be more of a balance and more of a compassion in the way that some of these messages are communicated? Could it be for those who are most vulnerable that the restrictions are lessened for those people initially? Because I think for those in most need, that's really important.
And as you touched on, if we aren't getting this balance right, there are potentially tragic consequences. And in that vein, I want to bring in Professor Ellen Townsend.
We know that in times of, let's say, social cohesion, like during wars and so on, actually we see decreases in suicides. We've also seen quite a lot of economic support so far for people. So it's protecting furlough, for example, is protecting livelihoods and so on. So there are some things that are protecting people for now. What we do know from global data is that suicide rates track very closely economic downturns. So when you have periods of serious economic downturns, suicide rates go up. Two other really important points. Data about children is worrying. So a report in May showed that there had been a possible increase in child suicides, but the numbers were so small that we weren't able to tell whether that was robust statistically, but that was only till May. And also a number of studies have shown that suicide ideation has gone up, particularly in young people, even in the first 6 weeks of lockdown. And I think that's really significant. So we won't really know for a couple of years what's happening with suicide, because I think the effect will be delayed, but we should be doing things about it now to make sure that those rates don't go up, particularly in young people.
There are other impacts, aren't there, upon young people and children as a result of this? What are the additional risks?
Well, in terms of social isolation, we know that the mental health effects of loneliness and isolation can last for up to 9 years later in terms of mental health effects. So we're talking long-term effects. In terms of social interaction, this is how children and young people learn about the world. It's how they learn to communicate. In the teenage years, the brain literally rewires itself, called pruning, according to stimulation in the social environment. So we've just done this massive experiment. We have no idea how that is going to kind of impact on brain development in teenagers. We know, unfortunately, that domestic abuse has gone up. Calls to abuse charities have rocketed. Calls to charity about self-harm have also rocketed. Really, really enormous increases, which is interesting because, again, presentations to hospital went down, mostly because people were told to stay at home and not to go to hospital. So people were seeking support from other sources. Impacts on education, obviously, we know that access to a good education can, be transformative in terms of social capital. You don't get that chance again in life. And we also know that, people who have good access to high levels of education have, longer life expectancy. And then you've got the impact on parents, and, parents are really struggling. And of course, children will be feeling their experiences as well, and they can't really escape from it at the moment. So we've got this kind of perfect storm. I think one of my colleagues early on in the pandemic called it, for mental health problems really becoming a very, very serious issue.
What's your view, Professor Townsend, on what this effect is going to have on development, not being in person in a school, but instead being done at home with parents and over the internet?
Well, unfortunately, it's just not comparable. And I think I heard someone had estimated recently it's about, equivalent about 20% of actual learning that children are getting. But of course, it's not all about intellectual development. Social and emotional well-being is very important, and that's known and actually integrated into school curricula now, because we know how important that is. Children need children. That's what Dr. Sunil Bhopal said recently, who's a consultant paediatrician. They need to be amongst each other. They need their independence away from their family to develop all these really important social and emotional skills. So they're developing attachments with each other, which are not happening in the way that they would normally occur. We know that these attachments can be protective for good mental health and so on. There are children for whom playtime is the only time they really get to socialise with other children. There are children for whom school is really only the safe place for them to be. And unfortunately, a lot of vulnerable children aren't going into schools for myriad reasons. So we do have a really enormous crisis. I mean, every day, I don't know what Dr. Sidley and Dr. Wilde feel. I feel every day there's a new report out now demonstrating the impact that this crisis is having disproportionately on the well-being, emotional well-being and mental health of young people.
It's important to be thinking about the number of wider implications which we're seeing amongst children, amongst families, and I don't always think that that's captured correctly. Okay, so for example, to capture and condition the imagination of the public is that we see someone in a COVID bed, and then they're interviewed by the media interview a nurse or a doctor, and of course that's absolutely essential that we get good information about this, and that all the correct things are put into place to help with this. But I think it's done to the extent that when the public sees someone in a COVID bed, they think to themselves, you know what, all these measures, all these closure of what are deemed non-essential services, people missing out on various health appointments, psychotherapy and other things, lockdowns, all the restrictive measures, the communication style which is being used, masks, they think that they're all justified because of the virus, okay, which we've identified is a serious public health problem. What I don't think is picked up and captured enough by the government, by SAGE, by the media, is the impact upon children, the impact upon families, the impact upon the vulnerable, the impact upon people accessing mental health services. As Dr. Sidley said, the whole public is lots of people are affected in lots of different ways. And that is not being seen and being captured properly. And just because a person isn't in a COVID bed, they still matter. That's important to remember.
Yeah, well, I think, first of all, people need hope. We are at the point now where we have been living in a disaster, really, for nearly a year. And we need hope. We need a clear, concise plan, which is really clearly communicated with concrete dates about when things can be lifted and never return. And I think that's really important. We must have absolute clarity about this. Mental health, I think, has to be a priority focus. A good number of us, even though we won't develop clinical levels of distress, will be experiencing anxiety and depression and all the things that we've talked about in relation to social isolation and loneliness. Let's not forget those things are as bad for us. Loneliness is as bad for us as smoking and obesity in terms of our, our overall health. Okay, so these are serious issues. Schools absolutely need to come first. We should be putting children first. We should put children first in all that we do, and we've simply forgotten that. We've simply forgotten that in this pandemic. So schools open with a focus on social and emotional well-being. Okay, yes, we're all keen for kids to catch up with their academics, and they will, but they're not going to be able to do it unless we address their social and emotional needs first. So engagement with the arts, sports, and all those things that they love that enrich their lives are really vital. And I just must concur with both of my colleagues here about the de-escalation of the language and to remove fear messaging so that people can sort of reinvigorate their cognitive roadmap and start to understand things in the world that are risky and not risky so that we can make sensible decisions for ourselves.